Hello and welcome to our IVF webinar. This is Caroline. I am your host. And today we have another topic to talk about, to discuss. As always, please let me know that you can hear me. And hi, Kelly. How are you today?
Great, thanks. How are you? Coping with lockdown? Oh my goodness, I'm hoping everyone else is coping with lockdown as well.
Yes, all good despite being on lockdown. So thank you for coming and joining us and our Stronger Together initiative. Thank you so much, everyone, for confirming that you can hear us. And let me briefly tell you about our topic, and of course, let me remind you about our partners. And thanks to them, Stronger Together initiative has been able to exist. So therefore, have a look at them, ambassadors and partners of this initiative. So you can see them right here. Some of them actually had a chance to already have and join us during our IVF webinars or online patient meetings. Some of them will still have a chance to be here with us. So thanks to all of them. Without them, again, this would not be possible. And tonight, actually, we have another very interesting topic to tackle, but also we have a very special guest with us tonight is Kelly Saynor, and she is the director at the Fertility Pharmacy. So she will start with her presentation and will explain how everything works, and she will talk about the topic is UK support for patients returning home from an IVF international clinic. So she will be able to explain all aspects on how her company works. And after the presentation, this will be your time to ask your questions. Remember to type them in the chat section, and Kelly will take care of them one by one. We will have another guest actually during our Q&A session. Okay, you will see her. Wendy Monroe will be with us during our Q&A session. That is it from me, actually. Kelly, are you ready to begin?
I am. I'm ready to take it away.
Happy to do that.
Thank
Already.
you.
Go ahead and we'll start with the presentation then.
Lovely. Hi, everyone. I hope you're all well. I hope you're coping with lockdown. It's really a scary time for all of us, but fingers crossed that we are coming out the other end and we'll all be back again to our new normal, if that is what's happening. But thank you for joining me, as I really appreciate it, and thank you for listening to me tonight. So let me first just talk a little bit about who I am. So I'm Kelly. I am clinical director of the Fertility Pharmacy, and I'm going to talk to you about the Fertility Pharmacy, our nurse at home service that we have, and hopefully you can ask me some questions at the end, and I can see if our service will be able to be of any use to you at all. I really hope it will. Okay, so I know that there might be some listeners tonight listening from other countries other than the UK, but I think this is important for me to let you know that it's really focused on patients from the UK that have sought treatment or are thinking about seeking treatment abroad. I think it can be, and know already, that it's actually a really daunting decision to choose a clinic abroad without knowing exactly how much support that you might receive, when you come home. When you choose a clinic abroad, obviously you can't just pop in, and ask questions. It's a bit more tricky than that. So I really want to just talk about how we can make that easier for you. We know that patients often come back from their clinic abroad having struggled with things like, how do I obtain my medications? How do I access the right type of support? And by support, I mean practical support, emotional support. So today, what I want to focus on is what you're going to do when you get back to the UK. And I know that the IVF, Where IVF team on here actually do give a lot of guidance, because they're extremely knowledgeable about that sort of thing, about everything to do with choosing the right clinic. They may have already given you some helping hand. But let me first concentrate then on how best we want to manage your next steps of the IVF process, like I say, when you get back home. Okay, so tonight you'll find out who we are, what we do, and how we can help you. Okay, so very first of all then, who are we? So we are a team, you can see here, we are a strong team of medical professionals, expert pharmacists in the field of IVF, as well as being regular pharmacists, and customer service people who have not only had their own personal experiences actually of the IVF process, but understand how we can complement your service, the excellent service that you receive from the clinic that you have been to abroad. And hopefully what we want to do is fill in any gaps that there might be as you go through this process. Because I think it's really important that we know that when you come back from your clinic, it can feel quite frightening, and it can feel quite daunting. And to make the process slightly simpler and to give you the best start is where our focus is. Okay, so let's have a little look at what we can do for you. So we are a traditional pharmacy. With specialist pharmacists that can deliver medications right to your door. So that means not worrying about finding and searching for a pharmacy that might not be able to understand the technicalities of the IVF world and the IVF medications and fertility medications, more specifically. We also have our really unique nurse at home service as well, and what they can do is actually watch you give your first injection, and also they can help give you your intralipid drip should that be something that you have been prescribed. So why we want to help you, really, really important. We really want to help you because some of our team have been through this, some have had family members that have been through it, I'm one, and it's such a personal process. It's important that you know that we are not corporate or faceless. And really, let me just talk to you now about what drives us. I think that's a really important message for you. It's really important that you know that. So this is why we started the business, actually. Many of our friends and family have been through it. Lots of people tell us that they feel quite alone, panicked, scared, sometimes even at a loss as to what to do next. And it might feel like there's some distance between you and the clinic when you get home. I'm sure that you have got fantastic, as we already work with, patient support workers and people like coordinators, but it's important that there's an end-to-end service that we can help you with as well. So this is what drives us to do what we do. Like I say, many of our friends and colleagues have been through it. Our team of we have a team of specialist pharmacists and nurses that are able to support the infrastructure that we have to bring you the best possible service in what is kind of known as a bit of a fragmented industry. We also know, like I've said, how confusing and emotionally challenging this road can be for you. So our focus is solely on you to deliver you the correct medications, to work with your clinics, and to make sure that our nurses can be the best that they can be. So let me talk to you then a little bit about some actual patient experiences, so patients that we've helped, and then I'll go on to talk a little bit about our service and how you can access it. So interestingly, first of all, I just want to talk to you about experiences from our guest blogger that wrote for us on our website an amazing article about what she'd been through. So it puts it into context for you. So I'll just read a few. Injecting a syringe into a rubber bean bag is nothing like jabbing an extremely sharp needle into your own considerable rolls of fat, because it may come as no surprise that stabbing yourself with a pointed object goes against all of your own natural instincts. And she goes on to say, especially on the first night of your stims, when your anxiety will be at an all-time high and you know that getting it wrong literally could mean the difference between baby or no baby. And this is her words, not mine, but it's just really interesting to see that she's talking from personal experience. She then goes on to say, it was our first night of stims. That's IVF slang for the stimulation phase of treatment, in which you inject yourself with medication for around 8 to 14 days to induce your ovaries to produce a bumper crop of their finest eggs. And she goes on to say, I will never forget the rising panic I felt as 7 p.m. came and went. This is really daunting. It's emotional. It might sound familiar to some of you. It might not. It's worth just knowing that this is a really personal experience for this person that wrote for us. We know her as well, and it really was something that she was very she's very emotional about and talks very personally about, as you can see here. But it just goes to show, I think that our service, I think, will bring you some emotional relief. So again, this one really explains things really well. I was wildly trying to remember what the nurses had told me. 6 weeks previously. Yes, 6 weeks. When I'd sat blinking and nodding at them during the all-important injection teach session, but my mind was blank, totally empty. To have a calm, professional and friendly steadying hand right there next to me on that first night would have meant everything. I think they're just amazing takeaways, and I'm hoping that will all resonate a little bit with you, because it did with me. So these are experiences of patients of ours that have actually used our service already. And one patient says, thank you so much for all of your help with this. You've made this process so much easier. Hearing the reason behind your company also warmed my heart. Thank you for taking some of the weight off my shoulders. And then another lady, and this is the last slide, so I won't bore you anymore with these, but it's just worth looking at, isn't it? Thank you. It was so lovely to see you, and thank you for all your help and support. Your service is essential to support a couple starting their journey. To have a nurse visit your home in your own environment and safe place is very important emotionally. Please pass on my feedback to your team. Just did my second injection this evening with no problems. I will keep in touch. I mean, that's just, that's just fantastic. I'm so pleased that we've been able to help. So interestingly, I think what's really important is understanding where this all came from and why we feel this process and this service is really important for you. So current market research suggests that the greatest fear that you'll be going through is getting the self-administered injection wrong, spilling the liquid, getting the right dose, which, let's face it, is going to compound your anxiety that you may already have. If you have it, you might be perfectly calm, and that's absolutely perfect too. But we know it can be quite stressful. So we just want to make that process as easy as possible. So you'll undoubtedly have questions for us when you return back home. So let me just read a few of the questions that some people have already asked us. Will the drug the clinic has prescribed to me be available in the UK? Well, believe it or not all drugs are available in the UK. Some of them are very pertinent to the country that they were prescribed, or the doctor that is using them has prescribed from. So that's actually something worth noting. But what happens if the drug is not available? So what we can do is we can not only convert a prescription into a UK format, but we can also interpret that prescription, have a look at what other drugs are available, and offer the clinic an alternative suggestion, and they can maybe choose to give you a different version, but only if your clinic works with us on that. We wouldn't take it upon ourselves to write prescriptions. This is something that we would collaborate with your clinic, so you can go directly to them, or we can speak to them. Will you be able to find me an alternative? Well, I've just answered absolutely yes. We can suggest an alternative medication if that drug isn't available to you. And there are lots of the same type of drug available. But there are lots of pharmacists actually that wouldn't be able to do that, wouldn't know actually which medications would be a great alternative. So we can suggest that. How do I get needles? Well, if you're going to do any injections, it's important that you have needles. So we will always add those in for you. And the same with a sharp spin. Will I need a sharp spin? If you're injecting, yes, you'll need a sharp spin. And we'll tell you what to do with it after you finished using it. So what we've been able to do is, in order to make this a little bit more simple for your clinic and for you, is create a templatized prescription. So if you come to us directly, which some of you do, some of you already have done, we can fulfill your prescription and liaise with your clinic. What we might do, however, is suggest to them, or if the clinic comes to us directly, if they're already working with us, is suggest to the clinic that we can use a templatized version. So they can give us their list of preferred medication, and we can suggest the ones that are available, and it makes life a lot easier. There's less toing and froing between you, between the clinic, between us. It makes it a lot easier for you, and we, like I said before, we can suggest alternatives, which takes away a lot of stress, because it is quite stressful trying to work out how you're going to get them, because we know also this is quite time sensitive for you. There might be a start date for you. So it's really important that we try to remove all of that stress and allow you to just receive the medications, and we do all the bit in the background, if you like. So, like I say, we can fulfill, just to recap, we can fulfill your prescription if you come to us directly without a clinic, or if you're working with a clinic. And we can work with that clinic already and do it through the clinic. But we'll always liaise with the clinic, whether we're partnered with them or not. Okay, so let's have a little look at our home care delivery. So we can dispense and deliver medications direct to your door at an arranged time, and our pharmacists are the real experts here in knowing the IVF drugs and knowing the alternatives, like I've said, in the case of things like out of stocks, or medication that has not been around in the UK, or changed manufacturers, that sort of thing. They're extremely knowledgeable about that sort of thing. We have an amazing distribution service as well that are trained to be discreet, to be reliable, and to be on time. Again, because we know this is extremely time sensitive. And we'll always inform you of your delivery, and we can deliver to anywhere in the UK and Ireland. So, the all-important nurse at home. So, our expert nurses are that we provide is a really unique service, and it's a great service to help you at the beginning of your journey, because they will be able to sit with you and watch you deliver your first injection. Now, I've explained before why that's the case, but it empowers you to give that injection the same way every time, without worrying about the dose spilling or that sort of thing. And it gives you the confidence that I think you might need, if indeed you need it. Gosh, I've been given my background's nursing as well, and I've given myself an injection, and it's extremely daunting. I think I had to get my husband to give me one at one point, but it's quite tricky. It's quite scary, especially, like I've said, it's not a rubber bean; it's coming towards you. So we can give you that. But our team of nurses are always are extremely qualified. They're extremely well trained, and we always encourage you to ask any questions while I sat with you, to just allay some of your fears, to have a look at your protocols even. But we do want to make sure and reiterate, actually, and we do, when we give you the information that we will be giving you, is to go back to your clinic. We don't want to tread on the toes of your clinic. It's really important that you listen to what they have told you, and we will try to emulate and do the same thing. So any specific questions about clinic things, it won't be to our nurses. We'll ask you to go back to your clinic, so your protocol remains the same. But anything that you have that might be burning or tricky, or anything to do with our service, and maybe a few questions that are more difficult to go back to your clinic with in some cases, we do have specialist IVF nurses that are on hand that can speak to you. So please email us about that as well. So on a practical support level, I can't emphasize enough how passionate we feel in providing you this have this practical and emotional support when you get home. We aren't just about medications as a fertility pharmacy. As you can see, we have the nurse at home. So it is about you and making sure that we give you the best possible start, the best possible chance that you can. And like I said, it's a very personal journey for you, and we take that very seriously. So it's not just about the medications, it's about you and how we can help you get through this and feel the best you can possibly be. So practically, just to recap on this slide, we will take responsibility for your medications arriving to you at home. We have proper storage, so we can deliver things that need to be cold correctly. We can be in direct communication with you and your clinic. We have an amazing patient handbook, and that's actually really useful because it collates all the information that you might read on Google, filtering out, I think, some of the good and the bad, because it's not always easy to go through Google and filter that out and blink through it. As you know, we've got an injection coaching service, the nurse at home, and you can call our IVF specialist nurses if there's anything burning. But again, we would reiterate that we go back to your clinic if there's anything more pertinent about the protocol. So accessing us, how do you do it? Self-referral, we take many prescriptions from patients that refer in directly to us. So they send their prescription. We have an amazing upload section, dead easy to use, on our website. So you can upload your prescription there. It's extremely safe, all encrypted, so we see it and our pharmacists see it. You'll then receive, we'll research the medication, speak to your clinic. You'll receive a quote from us. You can then go on to accept the quote, should you wish. And if you wish to choose the other services, you can do that too. We will then, once you've accepted the quote, we'll prepare everything and get your medication sent out to you. Easy peasy. But you'll also receive the handbook as well, the patient handbook that we've got, which might just be a useful tool. But do email us, call us about booking the nurse at home as well. That's absolutely imperative that you feel that you're able to do that, because we have nurses dotted around the country. We don't have every pocket covered yet, as we're a reasonably new service, but we've been around at some time. So I think it's important that you know that we can get a nurse to you most of the time. Okay, I hope that was interesting and it wasn't too quick. It's taken me around 20 minutes or so, but thank you so much for listening. I really hope that you've enjoyed it. You stay safe, stay at home, and I look forward to speaking to you just in a few moments.
Perfect. Thank you so much, Kelly. That has been excellent presentation indeed. And your concept definitely sounds very interesting and so useful. I mean, there are so many patients that have been struggling with how to get this prescription, how to use it. I mean, for example, in the case if they are coming from some other countries after their treatment. So definitely very interesting, and I believe this is definitely amazing and so useful for me. Excellent. Really.
Thank you.
Thanks so much.
Thank you. I hope everybody enjoyed it.
Definitely. I mean, there are quite a few questions already. Okay. So of course we will get to it. So just to let me remind everyone that we will now go to your questions. So if you have any questions, this is your time to ask them. And of course, Kelly, and also now Wendy has joined us. Hi, Wendy. How are you feeling tonight? Can you hear us? We cannot hear you. Can you double check it? We cannot hear you. Just want to make sure. And we will start. Wendy, can you hear us? Okay, just give me a second. Can you try to perhaps join us again? Okay, seems that it worked.
Can you hear me now?
Yes, perfect. Yes, we can.
Good.
Fantastic.
Good. Thank you. Yes, I'm here.
Happy to have you as well. And well, as I mentioned, we will start off with the questions. Okay, so let's go ahead. with the very first one. Hello, Kelly. I would like to ask you if you recommend oral or injections.
I think it would depend on what route that your doctor has prescribed for you. I think that's very much dependent on the type of protocol that you might have and the type of patient that you might be. It might be extremely important that you go down one route or another. Sometimes I think when you have an oral medication, like the strength of the drug might be a bit different. So sometimes the drugs aren't available orally. Sometimes they're only available as an injection. So it's not always the case of choosing, actually. Sometimes, I'm afraid, sorry. It might just be, is it summer? Sometimes it's a case of just having to do it. If it's an injection, but if it's oral, brilliant.
Fantastic. Thank you so much for your question as well as your explanation to it. Now we have a bit of a different question, but perhaps you can answer it, okay? Do you know which countries receive frozen eggs from the UK? Are some countries abroad better than others at IVF treatment? I understand HFEA have certain guidelines for those clinics abroad which are due to receive them. It would be for a patient who is about to reach 49, so treatments could be being done up to 52. Many thanks. Is there anything you could advise?
If I'm honest, and I'll ask Wendy to jump in here as well. I wouldn't be best placed to answer that question. We don't know which countries are best. We know, of course, work with some countries, but we don't know which countries would be the best for you. I actually think that you guys, my IVF answers and your egg donation friends and your partners are much better placed to actually answer some of these questions. I think.
We are able to, but of course, Susie, if you could just drop us an email, we will be happy to provide you more details. I just don't want to miss this question, so Susie knows. I will put my email right here, and you can definitely email me, and I'll be happy to help you out as much as we possibly can as well. Hope that helps. All right, so thank you so much for this, and now let me go to the very next question. Do you accept the clinic's prescription directly? I'm using clinic in Spain for donor egg cycle, so my medication is all for my lining, but on my mock cycle, I found it very difficult and very stressful to get a UK pharmacy to accept the Spanish prescription. How can I get medication for yourselves using my clinic prescription? Thank you in advance.
Okay, Wendy?
I understand that there have been quite a few patients who've come to us with a similar story, actually, and that's why we developed the service initially to incorporate patients who were going to international clinics, and the idea of making a templatized prescription to make it more straightforward was just so obvious to us. And so it's as simple as that. We can accept a prescription directly from you. You can load it up to our website and we respond, as Kelly said, we send you a quote, etc. Or alternatively, the clinic can upload the prescription, obviously with your permission, because it's your prescription, you own that prescription. They can upload the prescription and we can work directly with them. And we are, as Kelly explained before, we have the expertise, our pharmacy team have the expertise to know which prescriptions are going to be fulfilled with the drugs that they've prescribed. So in other words, we always know which products are have a UK marketing authorization, which is already on the templatized prescription. So it's easier.
But if it's not a templatized prescription, it doesn't matter either, because we've received lots, haven't we?
It doesn't. But it makes it easier for the clinic eventually if we have sent them a templatized prescription. But with regard to the patient directly, like you directly, Lisa, yes, you can upload your prescription, or the clinic can upload the prescription, and there would be no waiting time because our pharmacists are expert at IVF medications.
So yes, we do accept Spanish prescriptions, and we would liaise with your clinic with your consent. as well. We've done that with many clinics that don't already have our prescription template, but once they find out that we have one, they do like that.
All right, perfect. That sounds really amazing. Thank you, Lisa, for sharing this, because it seems that, well, they can definitely help you, and lots of patients like you. So happy to hear it. And well, there's actually not a question next one, but I think you should see it. So someone has agreed.
Yeah.
Fantastic
Hi,
service. So just wanted to see you to see it. And of course, let's go to the next question that we have. What if you are unable to administer the injections by yourself? Would the nurse be able to provide the service?
Yeah, I mean, some of our nurses have been asked this question already. Would if you aren't able to administer it, we do offer a service that the nurse can sit with you, not just on the first day, but they can sit with you for 4 days, 5 days, 8 days. I mean, ultimately, we'd love you to do it. Because if you go away, for instance, or if you find yourself, a weekend break or away with work and you need to do it, you're in the situation where, you are the one doing it, and it can be more frustrating or daunting. But Naomi, yes, our nurses could absolutely deliver the injection for you if you really wanted them to.
Could I just add something else while this question is on from Naomi? It's also possible that our nurses could help to teach your husband or your partner or whoever you live with to help to administer the injection on the next night. So True. That's also a service. That's another. It may help in some cases. That's all I just wanted to mention.
Yeah, no, that's great.
Perfect. Thank you so much again for your explanation and for your question as well. Perfect. Thanks so much. There is another one right here as well. So what happens if the clinic sends an electronic prescription? Is that sufficient? Do the clinic, actually have to fill out the template, or can I just email you their prescription and you can fill out the template for me? I'm just concerned about turnaround time.
No, don't mistake us, Kay. Not sure what your full name is, but no, absolutely, they don't have to use our templatized prescription service at all. We've worked with lots of clinics that send us, or patients that send us a prescription that is in the format of their own clinic. We can still dispense medications from that format. We simply talk about the templatized version as an easier route for allowing clinics to have to not worry about this sort of to and froing of working out what medications are available. Absolutely, they can send us the emailed version of the prescription, and we can dispense from that. What happens in some cases, though, is that if the prescription comes to us via an email, then the clinic would be responsible, or you might be responsible for sending us the original prescription, which is currently UK pharmacy law, within 7 days, 2 weeks. There's a time frame attached to it, but we can go into it depending on how quickly that you might need to get the medications, or how easy it is for you to send the prescription back to us. But I hope that answers the question. But yes, you can just email the prescription to us. Don't need to worry about the template for now. That's only really if we are working with your clinic.
Okay, excellent. Sounds pretty easy indeed. So thank you so much for explaining this. Okay, thank you. Let's have a look at the next question. For intralipids, do we have to buy the medicine and you just administer it, or does the nurse bring it and it's included in your service and we pay you for it?
Yeah, a bit of both. Again, yeah, Wendy will be nodding with this. We've had both. We've administered it, so we offer the intralipid service, and we will charge you for the intralipid service. And of course, normally, if it's been prescribed, it will be within part of your medication package, and you will just pay for the nurse to come and administer it, if that makes sense. But some patients have also bought the intralipids and have had a nurse come in maybe and deliver that. Our service, though, however, you can do it both ways. We can administer it and you can pay for it and the nurse can come and deliver it. I hope that makes sense.
Yeah, it's pretty straightforward for sure. So thank you so much again for answering that question. Okay, let's have a look. There's another question here. Thank you so much for your answer. I was told that the UK had a shortage in the estradiol patches that I needed at the time, last September, October, and this was very stressful trying to get enough. Is there still this shortage now, or would you have no problems issuing an alternative? Sorry.
Well, yeah, we've come up against lots of different medication issues, and I can confidently say 100% of the time, and I think Wendy would agree with me, that we've been able to offer an alternative or fix it with with letting patients know when it's available. But normally we will let you know if there is a shortage and let your clinic know, so there is no waiting for it. We don't want to delay your treatment in any way, and normally if you have started down that route, Lisa, your clinic will probably want you to start using either an alternative, rather than wait. I would have said. Would you agree with me, Wendy?
Yeah, I think it is unpredictable, particularly at the moment with regard to European manufactured stock. This is a case. It is definitely more of a challenge, but we, like Kelly has just said, we have never failed to find either the product or an alternative. But we do, as we've mentioned, we always would liaise with the clinic first to make sure that what we can obtain actually would do the job that they want it to do. So we would never substitute a product. We're not allowed to substitute a product. We can only offer and suggest alternatives that are available. And as I say, we've not failed up to now, but we are in the middle of a pandemic. So I personally am not making any guarantees.
But estradiol patches, from memory, I think that we have prescribed those. But I would have to just check again. And if you want to email us directly, Lisa, just to confirm that, then please go ahead and email us. Visit our website and ask us some questions, or email us at hello@thefertilitypharmacy.com, or Kelly or Wendy .
Okay, perfect. Thank you so much for that. That sounds really excellent. So pretty simple as well. This is even better. So thank you for that. And also, just wanted to let you know that you can also just get in touch with Kelly and her team using this link. Okay, if you wish, all those queries, all those requests will be forwarded to Kelly and her team as well. Okay.
Can I just say one thing? I know
Sure.
that Kay's come back with. Just want
to say the same.
Yeah, thanks, Wendy. So thank you, Summer. I appreciate that. You told us that it was helpful. I saw your message, so thank you. But Kay just said, Caroline, that if timing's tight and she needs the medications within a few days and the original paper prescription takes too long to be posted, just to reassure you, we can actually dispense medications. I wasn't sure if I made that clear when I said it before, but don't worry. When you upload your prescription, we can dispense from the emailed prescription, so you'll receive your drugs before we need to receive the original.
Okay, perfect. Thank you so much for that. Someone is typing, so I just want to give it a minute to see if we have more questions, because definitely we have such thank yous, and I just want you to see them. Really, okay, great, thanks. This is the answer to your to your actually answers, right? So I'm very happy to receive them. Well, you saw it already, so Kelly, Wendy, that's much appreciated. Thank you for a great presentation of the service. Thank you for your comments, really appreciate that as well.
Thank you.
I'm just checking, we do have
another question.
Exactly. So let me go for it. Do you know when we will be able to go to Prague for IVF transfer with the current situation? Any news received recently?
Do you know when we were to go to Prague? Do you know, again, Victoria, it's something as a pharmacy service and our nurse at home, I can't give you any advice on when you'll be able to get over to Prague. And that's something very, very pertinent to Prague and the clinics over there. So I would just keep your ear to the ground, really utilize my IVF answers. Where IVF, egg donation friends, they, like I said earlier on, they're extremely knowledgeable, and they have a vast array of clinics to be able to recommend to you. So, Victoria, I would maybe ask them.
Yeah, well, it's still nothing official. That's from what I hear. But of course, some of the clinics have been able to reopen in Prague, and some of them will be starting off with the treatments. But of course, until, it's not possible to really travel, right? So this is the issue here. So right now we just need to wait for that official, official information that it's possible to simply travel. Last time I've heard, clinics in Prague, they're all reopening, and anyone that is able to simply get to them, this is possible, right? But usually they said it's possible for the patients that are close by, so perhaps Slovenia or Austria, just because it's easy to go there by car, for example. This is the thing.
Someone just said that the Czech Republic borders are closed currently until December as well.
We just need to wait and hope that it will be rather sooner than later, unfortunately. But we need to stay positive.
Stay positive.
Exactly. Perfect. Thank you so much. And okay. Someone has already commented that the borders. That is true.
Thanks.
For sure. Well, I do see some another comment right here, and I believe we will be slowly finishing, unless you have any last questions you would like to ask Wendy and Kelly, and if not, we will be finishing for tonight. But thank you so much already for your questions, for your comments, for joining us over and over again. And well, Wendy, Kelly, it's been a pleasure to have you here, and the presentation has been excellent. The concept, as I've mentioned, definitely sounds interesting and very, very useful. Lots of patients are stressed when it comes to this particular matter, and it seems that with your concept, it could make it a bit easier. So this is, excellent indeed. I'm just waiting. Someone is typing, so let's give it a minute. Sure. Yep, another. Thank you.
Thanks, Kelly. Thanks, Susie.
Perfect. All right, so Kelly, Wendy, is there anything else you would like to add?
Not for me. Just thank you so much for the comments.
Thank you.
Yeah, thank you so much. Stay safe, please.
Yeah. Exactly. There's nothing else to say. Just stay safe, and of course, have a lovely evening. And let me just remind everyone that we will be here tomorrow at 6 p.m. UK time in the night. 8 p.m. UK time. I apologize for that. And this has been recorded, so of course you will have a chance to watch it again. All you need to do is just use the link I have sent you, but let me resend it again so you can have it. And of course, all our events are uploaded on myivfanswers.com. You can actually follow us on YouTube channel, and that way you will be up to date when new video is uploaded. And of course, you will find all those events right there. So stay tuned. Thank you again so much, everyone, for joining. Kelly, Wendy, have a lovely evening too.
Thank you so much for hosting.
Hopefully, we will be able to have another session with some other interesting topic, because definitely it's something that we would like to explore. Definitely seems to be very useful.
Thanks so much for having us.
Thank you.
Thank you. Thank you, everybody.
Bye.
Thank you. Bye, guys. Take care.